I'll try to provide a very strict summary of some of the evidence using what I really love as an evidence synthesis tool, which is the umbrella review. This is my disclosure, so I get a lot of money from pharma companies, device companies, but actually known from tobacco or vaping companies. So actually, why am I here? Actually, because I am a former smoker, and I actually leveraged harm reduction as a tool to discontinue combustion smoking. So I really believe it can work, and it worked on my own. I'm also a clinical researcher, a cardiologist, and I'm also a bit concerned because I'm a father of 3 teenagers, and I'm wondering whether we are doing the right thing, leveraging these new products or not. So, of course, e-cigarettes, heated tobacco products, nicotine-releasing, devices, whatever. I believe that we need to focus in general terms on these devices which do not entail combustion. Of course, there are some of them which are possibly safer or may have distinct toxicities in comparison to others, but in general terms, we now can consider them similar. Of course, there are substantial differences, but the key point is we could leverage anything that does not entail combustion. Of course, there is a global uptake, irrespective of what legislators will do. There is a huge market, a huge interest from people, from companies, from big companies to smaller startups and so forth. What is an umbrella review? Basically, if you do a study, you actually enroll patients, or if you're a basic researcher, animals. And then you can pool studies with a meta-analysis, with a systematic review. Once you have a lot of systematic reviews, you can't tell what they're saying. And so somebody came up with the idea of summarizing several systematic reviews. So conducting a meta review or umbrella review, and we've done a few of them, and for anyone interested, it's not that complicated, though it requires some steps to be followed. And actually you can search for systematic reviews published in clinical journals easily using a similar search strategy, and there are not many umbrella reviews on novel tobacco products, e-cigarettes, and so forth. But still there are a number of them, at least 10. Some of them are not pertinent. One is very interesting from Travis. It actually highlights that several systematic reviews have methodological issues. And indeed, if they have issues, those reviews, we might assume that the studies included had some methodological issues. So one take-home message is that the evidence base is not that strong as we would like. Another one from our own group is on safety. Of course, not vaping, not using heated tobacco products, not taking any nicotine is probably the best option for your health. Still, possibly is less detrimental than combustion smoking, but you need to be aware that some risks are there. Of course, you may have effects on platelets, as Professor Ikonomidis showed, effects on lung function. There might be some CO released when you use heated tobacco products and so forth. In the best case scenario, even nicotine may lead to tachycardia, to increase in blood pressure. Even slight increases might be meaningful for a very sick patient. Irrespectively, whilst the evidence is very limited, it is clear that vaping cigarette, heated tobacco products may improve cessation rates, and they may be leveraged at least on a par level with drug therapies or behavioral therapies and similar interventions. It's also true that there is an issue of relapse. Of course, if you use varenicline or NRT to discontinue combustion smoking, you may relapse, but it's a different kind of relapse. it's like going back towards a bad habit you had. Instead, the perk of e-cigarettes, but also their weakness, is that you maintain the ritual. You maintain all the rituals of using the cigarette, for instance, after lunch, when you are unhappy, when you are nervous, and so forth. And so there is a distinct risk of relapse and possibly also uptake of new smoking habits among patients exposed to e-cigarettes or vaping or other harm reduction strategies. There is also an issue, as was highlighted just a few minutes ago by our colleague from South Africa. There is an issue of how can we protect children from being exposed, from using these products, from not being manipulated into becoming new smokers and new addicts by whatever companies and so forth. I believe I'm reasonably intelligent, but nowadays we must be able to be challenged by artificial intelligence. So I asked the ChatGPT, please do an umbrella review for me on this topic, and actually it came out with some good replies. So I asked, what are the main findings of available umbrella reviews on electronic cigarettes, modified with products of tobacco or vaping? And it summarized that e-cigarettes may be effective tools for smoking cessation. Okay, this is credible. Indeed, they are less harmful than traditional combustible tobacco products, but there are substantial concerns in terms of youth exposure and exposure to non-smokers. For instance, we could envision a different track. I give electronic cigarettes, vaping cigarettes for free to smokers. Instead, let pay high taxes for naive users and so forth. There are some potential risks, including lung and cardiovascular issues. There is surely a need for stricter regulation. Stricter regulation doesn't mean having a ban. For instance, my brother, older than me, he began driving his motorbike and there was no helmet requirement. Instead, when I took my bike at 14, I was required to wear a helmet. I'm still driving a nice Ducati, an old one, but it's performing, but I always have my helmet. So the idea of regulation doesn't mean to ban altogether something. There is an issue of dual users, and this must be discouraged because we lose the strength of the new product to be a way to discontinue the old product. We are lacking long-term data. We don't have 20-year cohort studies. And of course, this is the dark side of the moon. And there's also a huge variability in products, and it's very difficult to generalize. In any way, the findings and conclusions of available umbrella reviews, systematic reviews, and original studies are really depending on the design of them, the scope, and typically these are limited by quality issues. In conclusion, e-cigarettes do increase quit rates in comparison to nicotine replacement therapy, and evidence comparing nicotine and cigarettes with usual care on treatment also suggests benefit. We do need high-quality studies to confirm the effect sizes and, of course, longer-term follow-up of all these studies. We also need very, detailed comparative studies between different types of e-cigarettes, which are lacking, and research is better, is really weighted to better define the optimal transition, because in our perspective, these products should be leveraged as a temporary means to discontinue combustion cigarettes with the ultimate goal of total abstinence from anything. Many thanks.